4 months ago, South Africa seemed well poised to deal with what was ravaging countries around the world. On the 26th of March, it imposed one of the strictest lockdowns anywhere. Then life as we've known it stopped. It seemed to have had the desired result. Numbers started slowing down. South Africa's strategy elicited praise from many quarters, including the World Health Organization. The country seemed to be in control. It even extended the hard lockdown by a further 2 weeks.
Is the exponential spread avoidable? The answer, sadly, is that that's very, very unlikely. Put simply, no. We cannot escape this epidemic. Not unless South Africa has some special protective factor. Let's call it a mojo. We have some mojo that protects us that's not present anywhere else in the world. Our population is at high risk because all of us have no immunity against this virus.
As the country tried to manage the spread, the economy started hemorrhaging. At the beginning of May, restrictions were eased. There was even a 7-day window period to allow inter-provincial travel to enable some economic activity back. It was not long before the numbers started climbing again. When the easing happened, COVID-19 cases stood at 5,600 with 83 deaths.
This small growth in numbers we may be currently experiencing the calm before a heavy and devastating storm.
3 weeks later, on the 24th of May, the president announced further easing of restrictions, trying to save lives and livelihoods. At this point, 22,000 cases and 429 deaths had been recorded.
More than any other, we are reminded of the words of the father of our nation, Madiba, when he said, "It is now in your hands."
With more pressure from various quarters, further relaxations were announced on the 17th of June. Infections and fatalities continued to rise. The country reported more than 80,000 cases, closing in on the original epicenter, China. Deaths had breached 1,600 mark. The Western Cape was the country's epicenter.
We can expect infections in Africa to rise as countries start easing restrictions in the face of severe economic pressures, and we are working together as a continent to meet that challenge.
By this time, some school grades had been phased in, with more to follow. But the World Health Organization raised the alarm as the country became one of the fastest rising in infections. With more than 264,000 cases and close to 4,000 deaths on the 12th of July, the World Health Organization said it would offer support to South Africa, which accounts for half of the continent's infections.
We have been interacting all along. This is, a regular contact, and we have agreed to boost our cooperation. And as Mike said, all levels participated from our country office, regional and headquarters, and we will increase the frequency of our engagement, and based on some of the requests that South Africa has already done. So we will intensify our cooperation, and I hope to make progress in controlling the pandemic. Thank you.
A few days ago, the president was forced to close public schools as cases exponentially rose. The country now has the 5th most infections in the world and is currently the 4th largest contributor. Marking 4 months of South Africa's lockdown, there are many questions. Has the lockdown achieved what it set out to do? Can the country cope with the huge surge it is currently experiencing? Are we not losing the fight many had thought we had under control? We are fast approaching 450,000 cases and 7,000 deaths. And no one knows for certain when will we reach our peak. If the Western Cape has peaked, Gauteng is probably going through it, so is the Eastern Cape. KwaZulu-Natal is now rising fast, and other provinces are recording huge increases. The country will have to ride out the storm, as its people have been repeatedly told it's in your hands. Social distancing, wearing of masks, and washing hands. Mzwandile Mbeje, SABC News, Johannesburg.